when you are mentally ill, when you have a mental illness, and then you have a tendency to, walk around in your own circles. And I don't want to walk around for the rest of my life without doing anything.
I thought about counting how many times I wash my hands, but it's different from day to day because it depends on what I do.
Every time I heard the sirens, it was get very crazy in my head. Yeah.
Obsessive-compulsive disorder is a psychological disease associated with anxiety and stress. It is characterized by unwanted thoughts and repetitive behaviors, such as a fear of germs and excessive cleaning. People who suffer from OCD may realize that these thoughts are irrational, but the disease is what makes them feel trapped in their own compulsive routines.
When the OCD was at the top, I cleaned every day when I got home from school, like 5 hours. Before I could sit down in my couch and watch TV. And all the time I had, not a voice, but something telling me in the head that you have to fix it now.
This disorder affects people from all different backgrounds, cultures, age groups, and intelligence levels. The frequency of OCD symptoms has been found to be remarkably high only during the last decade. Now, it is among the most common of all psychiatric disorders, but the diagnosis can easily be overlooked if specific questions are not asked by the treating doctor. In some cases, this can lead a patient to receiving the wrong treatment.
I don't know if it was because they didn't know enough about the OCD, but they couldn't tell me why I had the depression or the anxiety. So they tried to help me with the depression or anxiety and not the OCD, which was causing the anxiety and depression.
An estimated 50 million patients worldwide suffer from this disorder. It is the fourth most common psychiatric illness in the USA. But the question remains, what causes this disease?
There are many different factors that can contribute to OCD. Genetic factors, environmental factors, and personality aspects as well. According to research, OCD usually starts around the age of 15. The mean age is around 15, but we've seen it start all the way down to the age of 4, and basically throughout the life.
Anna Rue has had OCD for 11 years, but she wasn't diagnosed until 5 or 6 years ago. When she was 16, Anna started getting really depressed. Since then, she has seen several doctors and tried over 20 different kinds of medications. She is now on a waiting list to receive treatment at a specialized OCD clinic.
The first time I realized that I had OCD and the psychiatrist told me that I had OCD, I could see that I was doing the rituals by washing my hands more. I was washing my clothes. I was thinking a lot about what all other people thought of me, and what if I was talking to someone, I was afraid that I would hurt them. I was afraid of the bacteria, or I was afraid that I would get sick of something, or I was afraid that I had cancer or AIDS. Before I go to bed, I have to brush my teeth for 20 minutes or half an hour. So, because I'm afraid that they won't be clean enough. I plan a lot how to do things. And then I couldn't sleep because I was thinking about all the things that I didn't do, or maybe I thought about the next day, how I was going to plan everything so I get everything in the right order.
People tend to get stuck in the way of behaving, and they see the solution as performing rituals. But then the solution becomes the problem, because you tend to use too much of your time to do rituals, trying to prevent some bad thing from happening, or trying to prevent an accident or whatever. But the thing is, by checking, you're increasing your doubts, and by doing that, it's very difficult to stop the checking rituals.
OCD is like a never-ending battle, because it's something. Sometimes it's like a voice in your head that says, "Then you have to do this, and you have to do this," and then, did you do it right, or did I touch that, or didn't I touch that, or it's constant doubt in your mind that you haven't done the things that you had to do to keep clean, or when I'm trying to fight the OCD, I'm thinking you have to stop this. Nothing will happen to you, but sometimes the anxiety just wins, and I can't fight it with my thoughts. Don't know, and I think it's easier if I just went out into the garden and buried a hole and buried myself. If I'm home and I'm going to take care of my guinea pigs, then I can touch the door handle. I have to touch it with my elbow, so I don't touch anything after I've washed my hands and before I go and out to take care of them. I have 6 guinea pigs, and I have had guinea pigs for about 10 years, but these are not 10 years old, but I've just gotten them because I love them so much. That's why my OCD is like stronger when I'm with them or around them, that I don't want them to get sick, just as some people, if they have kids, they are afraid that they might get sick. I don't know how I would be if I didn't have OCD, because I don't remember how I was before almost. So it's just like my life is like that now, and of course I hope it will change when I get the treatment.
Thomas Jorgensen has had OCD since he was 4. Since then, he has been struggling to lead a normal life. When he was 17, Thomas became suicidal. When he went to a psychiatrist to get help, he was diagnosed with OCD. The stress of the disorder led him to drop out of high school.
In my mind, I thought that it was something that couldn't be cured, that it was just something you had to live with. It was quite painful for me at that time, and I would drink, because when I drank, then it helped. But I had to drink a lot before I went away, and when I was sober again, it was there again. The bad thing is that when you have very bad or severe OCD, then you can kind of feel that you're crazy, and then you'll get low self-esteem. And when you get low self-esteem, then your OCD will be worse, because your defense system is down or worse.
When Thomas was 21, he was hospitalized at a mental institution. After living there for 3 years, the doctors released him. Since then, he has been on pension and living on his own.
People are often very ashamed of their OCD. They're ashamed of the thoughts, and they really, most of the OCD people are very insightful people. They know that these things are irrational, they aren't very logical, but they can't stop, and therefore they tend to hide or keep away from other people, and by doing that, people become lonely and isolated due to shame.